So liver cancer is an extremely common cancer worldwide, and if anything, we've been really struggling very hard to try to get new therapies for liver cancer. Uh, Between 2017 and 2018, we are seeing an incredible amount of new information that's really providing us enlightenment for new potential therapies for patients. And among which, of course, is immunotherapy, or what we call checkpoint inhibitors. Just the simple way of thinking about it is like as if the cancer cells are like putting their foot on the brake for our immune system, so it can't really fight our cancer, and simply we're taking their foot out and letting the immune system derive its activity against the cancer per se. And there has been a lot of improvements in that regard, and definitely there's already a drug already approved for that situation, and we are expecting more data to come in that regard. Liver cancer, or hepatocellular carcinoma, as we all know, it has been rather a challenge in regard to treatment when it comes to systemic therapy. Since 2007, when we heard about sorafenib, since then there has been no activity despite all great efforts in regard to other treatments that can be used. And between 2017 and 2018, we are hearing about a lot of positive data as well as even approval of new therapies per se. And I would say that other than the multiple tyrosine kinase inhibitors, or TKIs, there has been a major improvement in regard to the use of the checkpoint inhibitors, or what we call, in a big word, immunotherapy. If anything, the effort that has been done on multiple layers have led to nivolumab to be approved by the FDA in 2017, and this was based on a conditional approval based on phase 2 data, and we expect that further data will be coming out from the different studies that are ongoing. As we know, immunotherapy and checkpoint inhibitors can by definition work on any cancer, but no doubt some of them or some of those cancers are more prone to get that response compared to others. And liver cancer, because of its inflamed nature to begin with, appears to be, it drives a very receptive environment for the treatment with checkpoint inhibitors. And the early data has shown, in regard to preclinical work as well as phase 1 and phase 2 studies, a clear evidence of response to checkpoint inhibitors. And no doubt this is really where the future would be coming. Of note, by the way, what we have thought that maybe checkpoint inhibitors will be driven to work or not to work based on the expression of certain receptors like PD-1 or PD-L1 or what have we. It appears to be that's not necessarily driving the case in liver cancer per se.